So my name is Joel Tepper, and I'm from the University of North Carolina in Chapel Hill. So I'm a radiation oncologist. I've been so for many years, and I have a specialty interest in gastrointestinal tumors as well as soft tissue sarcomas. I spent a lot of time dealing with translational research, trying to get information from the laboratory into the clinic, and working to improve our overall understanding of oncology. Radiation oncology is not a field that one hears about very much at the medical student, but it was a combination of being able to use a strong technical background that I had, along with a strong desire to deal on a daily basis with patients, and very importantly, an area where I thought I could make a difference in terms of enhancing the field. So this is the third edition of Clinical Radiation Oncology, and we've been very pleased with the structure that we set up in the first two editions. And we tried to keep the aspects of the first edition that we really liked and that other people liked. So it's always been extremely popular to have a brief summary of the chapter, of the disease site chapters in the beginning to give an overview of the disease we're discussing. It has also always been very popular to have a variety of algorithms in terms of algorithms of how we work up patients and treatment algorithms. And basically in every disease site we have maintained those so that the reader can understand very quickly what some of the management strategies are, what the breakpoints are. One simply deals with a lot of text, and sometimes sometimes very difficult to find out exactly what you would want to do in a specific clinical situation. And so we've tried to keep this friendly and approachable for the reader who's going to be treating patients and trying to understand how to manage patients, as well as for the trainee to be able to understand what the critical issues are, to be able to get them ready to really practice medicine independently, and to give them the critical information they need to do such basic issues as pass the boards. We've been very happy with the second edition, so we did not make wholesale changes in this edition, and rather we tried to add some additional functionality to the book. And we've added a couple of chapters. For instance, one is dealing with late effects and more outcomes research, which is an area of great interest to the radiation oncology, and I think will contribute substantially to that understanding in that area. We've also maintained the full color format for the book, which I think, especially in radiation oncology, is critically important. So much of what we do is illustrated by graphics off of the computer, where the color capabilities are really essential. And so that functionality has been maintained. So I've always enjoyed books. Maybe most of us have always enjoyed books. And books has always been viewed, to me, and historically has been the source of knowledge and the place where knowledge is stored. And very importantly, it's a place where knowledge is codified. And so one can take the huge amounts of disparate information that's available, and to be able to put that together and to make a coherent story in terms of understanding a disease or a disease process, understanding a therapeutic modality, understanding a clinical approach, is very appealing. That synthesis of information is important. And I like to write, and I think I write reasonably well. And this is just a wonderful way to combine that, along with what I've been all my academic career once I finished training, which is dealing with education, educating residents, educating even people who are in practice. And this is a way to enhance that educational effort in a substantial way. And so, and in some ways, the combination of the textbook Clinical Radiation Oncology along with seminars in radiation oncology is a perfect match, because clinical radiation oncology as a book provides the global outlook, providing a very total overview of what's going on within diseases, within treatment modalities, and the like. And seminars in radiation oncology is an ability to address a very topical area that's changing rapidly, where there's a lot of controversy, and to be able to present different sides of the story, and to be able to really keep someone updated on what's new and exciting and happening. So they complement each other, I think, extraordinarily well.